Hello everyone. Today's video is for all the intensivists and all the critical care specialists who take care of terminally ill patients and who encounter death. Many times our juniors they ask us, sir, what should I write the cause of death? When this discussion pops in, suddenly we are not very confident. What should I answer? Not because we don't know the diagnosis, we very sure we know the diagnosis, but we are not very confident or clear what should be written in this form, which is cause of death form, which is form 4. So let us discuss today what is to be included and what is not to be included in this form. So here we go. I am Dr. Dattatreya More. I am Assistant Professor of Medicine, and today we'll be discussing about this cause of death certificate and how to mention it correctly, how to fill this form correctly. So this is the usual form, form 4A, and this part our juniors they ask us, what should I include in this? So this form has got part 1 and part 2. And in part 1, you see there are 3 lines. And in part 2, all other significant conditions which have contributed to death we have to mention over here. So what is to be filled over here? This is form 4, the entire form 4. And on the top of the form, there are details of the patient, name of the patient, age of the patient, gender of the patient, name of the hospital, and when the death occurred, date and time. We are concerned about this part, what is to be filled over here. And in next 10 to 15 minutes, I'm going to discuss what is to be included in this form. So just go through this form and tell me whether this form is correctly filled or incorrectly filled. Here, the direct cause of death they have mentioned as terminal cardiorespiratory arrest due to bilateral aspiration pneumonia. And the patient had alcoholic liver disease with liver cirrhosis, with portal hypertension, with moderate ascites, with esophageal varices, with hepatic encephalopathy, with coagulopathy, with hepatorenal syndrome in a chronic alcoholic. I myself I have filled these forms many times in such manner, but sadly this is incorrect way of filling the form. And why is it incorrect? I'll tell you. See, have a look at this form. So here in part 1 and part 2, part 1, at the bottom they have mentioned a patient had iron deficiency anemia for which the patient underwent blood transfusion and had a blood transfusion reaction, that is anaphylactic shock. And the duration of each is mentioned. The patient had anemia since 2 weeks. Patient received blood transfusions 30 minutes back, and patient had anaphylactic shock 30 minutes back, and the death was because of this anaphylactic shock. And this patient was pregnant, 8 months pregnant. So this is the significant condition contributing to death, but not directly related to it. Why did the patient had anemia? XYZ reasons. But here, it was associated with pregnancy. So this is how it should be written. Only one cause in one line, and at the bottom, at the top should be immediate cause, then the intermediate cause, and then the underlying cause. This is how it should go. And it has to be very specific and clear. Why did the death occur? This form answers only one question. What was the cause of death? They are not interested in the medical history. Because what happens with this form is, uh, once you fill this form goes to the local civic authorities. And these local civic authorities, what they do is they send this form to the state authority where there are coders, medical coders, and they put code to each of the cause of death, and this goes to our national registry. So this national registry, they compile all the data received throughout the country in last 1 year, and then they come up with a report every year saying this is the percentage of cause of death. So why this is necessary? There is an Act 1969 Act called as a Registration of Birth and Death Act. And according to this, we are supposed to medically certify the death. And that is called as Medical Cause of Death Certificate, MCCD. And we are filling this medical cause of death certificate or medical certification of cause of death, in other words. And there is one form which we fill, that is form 4, that is for all health facilities. Non-health facility deaths, they are to be registered on form 4A. And along with this form 4, we get form 2, wherein we fill all the demographic data of the patient. So this is the usual form 2 and form 4. Form 2, our hospital admin staff fills and the physician is called to fill this form 4 because they want to be sure about the cause of death. Now, there are studies they reveal that 50 to 60% of medical certificates of cause of death are incorrectly filled up. What is the reason? Reason is number one, they are not trained how to fill the form. That is the single most reason. And second is ignorance or indifference while filling this form. The most important reason is just because they are not trained how to fill this form. They have not been told what happens when this data goes to the local civic authority, how this is coded, and how the report comes in. So I talked about this national register, and coding for cause of death is done as per WHO guidelines and ICD codes. And this finally goes to Director General of Registers, and the annual report is prepared on all the statistics about medical certification of cause of death. And what happens after this is this helps in policy making, decision making, fund allocation. Like if cardiovascular death, if this is the leading cause of death, then the fund allocation or the policymakers, they give priority for that area. So this is very important to help the decision makers and the policymakers to come up with some concrete decision as far as disease prevention is concerned. And complete and correct information is important, and it is as important as our medical history in the case sheet. So this one part is not to be ignored, and this is how the report looks like. Report on medical certification of cause of death 2020. So every year, this department publishes the report, and it tells graphically, pictorially about what are the different causes of death. Now, if you look at this data from 1991 to 2020, look at all the deaths which are registered, total registered death, and those this orange line is medically certified deaths, and this is red one is registered death but not medically certified. So if these are correctly medically certified, then policymakers get a robust data on which to act. Now, since we are not sending this robust data, we are not filling this form correct, and whatever forms we are filling, those are also incorrect. So just imagine what is left in the hands of the policymakers. And this is the data of different states. National average. This is state-wise percentage of medically certified deaths. And national average is 22%. Maharashtra, it is 42.8%. Goa, it is 100%. And surprisingly, I found Kerala, it leads in all other statistics, but here it is lagging behind the national average. So training is very important as far as certification of cause of death is concerned. Now, if you look at this MCCD data, and this is about 2020, what were the leading causes of death? Cardiovascular system, diseases of the cardiovascular system. You can look at this, diseases of the respiratory system, so on and so forth, injuries, illness, nutritional deficiencies, poisoning, and other unspecified things, other groups, which is not very clear. So if you are a policymaker and if you look at this chart, which section you will prioritize as far as taking action is concerned? Obviously, the leading cause will be taken care of. So that is why we need to correctly certify what is the cause of death. Now, how to go ahead about this? It is very simple. Just have a look at this slide, and this is 80% of my talk. Part A contains immediate cause, intermediate cause, and underlying cause. And Part B contains comorbid conditions contributing to death but not directly related to it. So Part A, what should we write? At the bottom, we should mention what was the underlying cause, because of which this intermediate cause came into play, and because of which the patient died, that is immediate cause. So because of this happened, because of this happened, because of the underlying cause, there is an intermediate cause, and because of intermediate cause, there is an immediate cause. So that should be the sequence. Then it becomes very clear for the medical coders to make the entries correctly, to code it correctly. And part B is all other comorbid conditions which might have contributed to death, but were not directly related to this sequence which occurred on the day of death. So this is the key concept. Now, these are the key points. first thing is to list the cause in the correct sequence. Here I give you an example. Iron deficiency anemia in a pregnant lady. Pregnancy is the comorbid conditions. Iron deficiency anemia, because of which they gave blood transfusion and because of which there was an anaphylactic shock. And we should not forget to mention the time duration. So this is the correct sequence. I'll show you a few more cases. The second is only write one cause per line. Now here we have written multiple things. What the coder should pick up from this. So although it is correct, it is although from our viewpoint it appears to be correct, we need to mention only few things, only one thing per line. So he has left this C and D vacant. Instead of that, we can mention one point over here, second, third, and fourth, most important things. Now, all those people who are gathering this data, they're not concerned with all the events which occurred with the patient. They're concerned with the thing which occurred because of which the death occurred. So we need to be little careful about this thing. Do not leave line 1A vacant because this is the immediate cause. Have a look at these two charts. Here, chronic alcoholism leading to chronic fatty liver disease leading to cirrhosis of liver, and cirrhosis of liver was the cause of death. Now here in this on the right hand side, you can see the first line is left vacant. The first line is to be filled at any cost. If you have anything, add second. If you have anything, you add third. Last line can be left vacant. So this should be the sequence. Here they have written chronic obesity and hypertension since last 20 years. So this might have contributed to fatty liver disease, but was not directly related. So this is how it should be. Do not leave 1A vacant. Now mention time intervals. Have a look at this. Here they have written cause of death as blunt force trauma to abdomen during fight, because of which there was a rupture spleen, because of which there was hemoperitoneum, and patient died because of hemoperitoneum. So we need to mention the time. This blunt force trauma was 1 day back, and rupture spleen was 3 hours back, and hemoperitoneum 1 hour, and because of which patient died. So here you see they have not mentioned the time. We forget to mention the time. It is very important to mention the sequence and the timing. So this can be months, days, and hours. It can be year to year, months, weeks, days, and hours. So sequence should be like this. So it becomes very clear for the coder. If this is into months, then this is into weeks, this is into days and hours, and because of which these thing D C occurred, because of C B occurred, because of B A occurred. This should be the sequence. Avoid reporting mechanism of death. Now this is very important. What is mechanism of death? Say for example, in the previous slide I showed you cause of death as cardiorespiratory arrest. Now everywhere we write cardiorespiratory arrest, cardiorespiratory as the immediate cause. Now, if all the data which goes to the medical coder, and if all the deaths, he finds that the only reason is cardiorespiratory death. Now, cardiorespiratory arrest occurs almost invariably into all the deaths. But is that cause of death? Cause of death, it is not a cause of death, it is a mechanism of death. You should not mention mechanism of death like cardiac arrest, hypotension, respiratory distress, respiratory failure, because these are terminal events. Invariably, they will occur in all the deaths. So don't mention mechanism of death, mention cause of death. Why this occurred? So write the medical condition or the event which occurred, like acute renal failure or primary hypertension or hepatitis B infection or maternal eclampsia or bronchial asthma or fall from a ladder. So we need to mention the medical condition which led to cause of death. Are you getting the point? Now avoid abbreviating conditions. Avoid abbreviations means if you write MI, so it can be either myocardial infarction or mitral insufficiency. The medical coders are not trained to know the difference between this. HTN, if you write HTN, it can be hypertension or hypertensive nephropathy also. If you write PVD, peripheral vascular disease, it can be pulmonary valve disease as well. MS can be multiple sclerosis or mitral stenosis. RTI, it can be respiratory tract infection or reproductive tract infection, so on and so forth. So avoid writing abbreviations. And lastly, mention the complete personal details, personal information of the patient, and then sign and stamp it. So we need to mention the name of the patient, age of the patient, gender of the patient. This is very important. And at the bottom, you need to put our name, stamp, and sign it, because who has certified this death is important. Then there is one more column. They ask about how was the nature of this death, whether it was natural or suicidal or homicidal or accidental. So majority of the times in medical ICU, it will be a natural death. If it is accidental death, mention so. If you suspect that it is homicidal or suicidal, send the body for postmortem or autopsy. So we need to mention age, gender, name, date, and time of death. Should not miss this. Manner of death, I talked about it, and whether the patient was pregnant, yes or no. So there is a column over there. You need to tick that, and then sign with your registration number. Put your stamp, and if it is an institutional death, on the half part below, they'll ask the medical superintendent also to sign in, where they need to mention the name of the hospital, and the medical superintendent will sign it. So this is how we fill the form. You can have a look at this. At the bottom, it is a medical superintendent certified on so and so person, resident of so and so, was admitted to the hospital on so and expired on so and so date. And this is what we talked about: A, B, C, and the underlying cause, and then nature of death, natural, accident, suicide, homicide, or whether you can mention pending investigation if you are not very clear. And if the person, if the lady was pregnant, yes or no. And if she was pregnant, then was there a delivery, yes or no. Here they have given the column for writing time, interval between onset and death approximately. So part 1 and part 2, part 1, immediate cause, intermediate cause, underlying cause, and the significant conditions contributing to death. On top part, we have name of the hospital, then died in which ward number, on what date, at what time, name of the deceased, then the gender and age in details. Less than 1 year or more than that, we need to write specifically. So this is how we fill the form. Avoid writing old age, senility, infirmity, advanced stage as the cause of death, because that is mode of death. It cannot be cause of death. There has to be some cause to it. Avoid writing signs and symptoms like fever, emaciation, listless, unresponsive, tachypnea, tachycardia, edema. These are all symptoms, not the disease per se, which led to cause of death. Cause of death should not be incomplete. Many times it is incompletely filled, not correctly filled. The handwriting is not readable, legible. So these things we have to avoid. Here, look at this: fall from a tree. A person had a fall from tree, had blunt force trauma to the skull, and because of which there was a fracture of the frontal and temporal bones of the skull, and there was cerebral hemorrhage because of this, and patient died because of cerebral hemorrhage. So, what is the cause of immediate cause of death? Cerebral hemorrhage. And why that occurred? Because there was a fracture of the skull. And why that happened? Because there was blunt force trauma to the skull. And why that happened? Because he fell from a tree. Look at this: direct cause of death, fall. So fall, for single fall, there are different codes: fall from the ladder, fall from tree, fall from heights. So there are n number of codes. If you go into WHO ICD coding for death, there are different categories. And why so many codes? So that the policymakers take appropriate decision and take action for all those preventable deaths. Now, some important points: do not delay. Give the cause of death immediately after death. You take your own time, and you just need to mention three things: immediate cause of death, intermediate cause of death, and underlying cause of death. And then some contributing factors. Since you have treated this patient, this should not take more than 2 minutes, 3 minutes, or at the max 5 minutes. We cannot charge fees for giving cause a medical certificate of cause of death. Do not withhold issuance of medical certificate, because this is required, because the relatives, they need the slip which we tear and give to them. This is required for cremation. So do not withhold giving this medical certificate. Do not sign in advance. Many a times, if the patient's condition is very critical and has a very poor prognosis, so you should not sign this in advance. This is very wrong practice. Do not issue without viewing or examining. You have not seen the patient, and some relatives, they come and say that this patient was taking treatment from you for so long and he has died at home. So where is the patient we already took for cremation? Now you issue the cause of death. Since you have not seen that patient and whether the death occurred or not, you have not examined the patient, it is incorrect to issue a medical certificate. When cause not known, send for autopsy. Whenever you have in doubt and whenever you are not very sure what is the cause of death, send it for autopsy or postmortem examination. Avoid incorrect filling because this leads to wrong statistics. And this cannot stand in court of law if this becomes a medico legal case. If you fill the form incorrectly and if you are called to give explanation for that, it will be very difficult for you to explain what was the cause of death. And in contrast to our medical case history, this form doesn't require all the details of the patient or all the sequential things which happened. They just need the cause of death and write in legible, good handwriting. Keep this confidential. And there are situations like, say, for example, two equally qualified colleagues, if they're asked to write this cause of death, both may differ on it. Now, this is because of the lack of training. Both of them, they don't know what exactly is to be written. Now, in spite of training, two people, equally qualified people, may have a different viewpoint, and there might be some differences in the cause of death, but that is acceptable as long as the certifying doctor or the certifying physician is sure about it to the best of his knowledge. So that is what it should be. You should not hesitate to mention whatever you feel is the correct cause of death if you have treated that patient. So that is very important. Now, all this data is available on the website crsorgi.gov.in. So all the data of births and deaths, they maintain the national register, and this is available on this website. You can click on this link and just visit this website. Now they give yearly, they come out with a report about medical certification of cause of death, MCCD report every year. Now, whatever we issue, this medical certificate of cause of death is different from a death certificate. How is it different? I'll tell you. The patient relatives or we from the hospital side, we send this data to the local civic authorities and they issue this death certificate. In the death certificate, the registrar only mentions that this person whose identity is this, Aadhaar number is this, was a resident of this place, has died on this date and this time. That's all they mention in this death certificate. So this is because of the medical confidentiality why the person died. So these two are different certificates, and that certificate is required for inheritance or for insurance purposes, LIC, and other things. Now, there is free learning available on Omnicurus platform. It's in 4 hours of free learning with certification. And this course is on how to certify the death or how to fill this medical certification of cause of death form 4. And this program is developed by Center for Cancer Epidemiology, Tata Memorial Center, and Center for Disease Control, USA. So it's a nice program. A lot of examples they have shared. And if you get time, you can enroll for this program and get certified, and you get CME credits also for this program. This is a very good program. And I give credit to most of this content of this talk to this program. Now, take home message. What is the message? List the cause in correct sequence. Only write one cause per line. Do not leave line 1A vacant. Mention the time interval. Avoid reporting mechanism of death. Avoid writing abbreviations and fill complete personal information, and then don't forget to sign and stamp. So if anybody is interested for case-based learning, like few case histories, and then how to fill the form, then you can message me or contact me. And I have developed different modules for physicians, for infectious disease specialists, for pulmonologists, for all oncology, for surgeons, for obstetricians, pediatricians, neonatologists, orthopedic surgeons, and all medical legal cases. So here we discuss, say, for example, if you're talking about pulmonologist, so 4 to 5 cases of pulmonology along with cause of death over there. We discuss about all the history and then how to correctly fill the form. If you are interested, you can contact me. I can forward you that module, that relevant module for you. So here are the few graphs of how this medical certification on cause of death yearly report comes up with interesting data. So from 2011 to 2020, this is the death due to diabetes mellitus. You can see how this is an increasing trend of deaths due to diabetes mellitus. So here the policymakers in a better position to take some action on this. Have a look at this distribution of death due to respiratory system or the causes. The most important is the pneumonia, asthma, emphysema, pleurisy, and other causes. Here, this shows about all the percentage distribution of medically certified deaths in male due to infectious disease. So that's due to HIV, that's due to diarrhea and gastroenteritis, that's due to other causes, septicemia, tuberculosis, due to malaria. So look at this septicemia. But whether the policymakers will be in a position to reduce this if you write septicemia. But if you write this as malaria, it is specific. Policymakers will be in a position to take some action. If it is tuberculosis, so now you might get you might be realizing how important it is to write correct cause of death. Look at this due to digestive system or GI, or this is for gastroenterologists, diseases of the liver. This is in male, this is in female. Diseases of the liver, then paralytic ileus, disease of the pancreas, peritonitis, gastric duodenal ulcers. So if you are a policymaker, what will you prioritize? Of course, you'll prioritize on prevention of liver diseases, alcoholic liver disease, or for that matter, all liver diseases, isn't it? Have a look at this genitourinary system, renal failure, 80%. This is for all nephrologists. 80% of the patients, the cause was renal failure. It can be glomerular disease, renal tubulointerstitial disease, and other causes. Likewise, for all other things, this is for oncology, malignant neoplasms of the digestive organ, malignant neoplasms of the respiratory organ, and malignant neoplasm of genitourinary organs, of the lymphoid tissue. So this part I would like to concentrate on, malignant neoplasms of the digestive organs, because this is what the statistics is. The nutritional disorders or endocrine disorders, diabetes mellitus, 86.8% of the deaths due to diabetes alone. And then a small percentage to thyroid, nutritional deficiencies, malnutrition, and others. Psychiatrists, mental and behavioral disorders due to psychoactive substances, delusional disorders, behavioral disorders, all other mental and behavioral disorders. So these policymakers, they get a tool on which to act if we correctly fill this medical certification of cause of death form 4. This is for child deaths, for pediatricians, infectious disease, circulatory system, respiratory system, nervous system, and all other major groups. This is for perinatal period, hypoxia and asphyxia due to respiratory conditions as a leading cause, so on and so forth. So for each specialty, I have developed few cases and on which we discuss how to fill this form correctly. We discuss the entire history, entire events, and then how to correctly fill the form. If you are interested, you can contact me, message me, and I will send you the relevant module for you. Now, what's new about this training program? In July 2014, there was an article published which showed that 60 to 70% of the errors were found in this form. And there was a recent study in 2024 also. They came up with similar statistics. Almost 60 to 70% of the errors are due to incorrect filling of the form. And I'll show this. There was a scoping review on the errors in the medical certification of cause of death, and this was published in July 2024. And they collected all the data for last 10, 15 years, did the scoping review for it, and came up with this conclusion. The major certification error were in the form of incorrect underlying cause of death. This was found in 8 to 99% of the cases, incorrect underlying cause of death. Then incorrect chain of events was found in 12 to 64% of the times. Then using abbreviations, incomplete death certificate, absence of time interval, all these problems were identified. Look at these figures. And if you go on the website, recently, our Home Minister, he made an announcement that this registration of births and death, people can do online. even for non-medical people, for general public, they can put their user login, password, and make an attempt to register all the births and deaths. And recently, he made an announcement that within few months, all the hospitals will need to report the births and deaths online. So this announcement came in maybe last week, the last week of October 2024, that all the hospitals, and this is seen on the website also, hospitals to report birth and death online. So there you will get only one option by default, and it will be automatically coded once you put over there. So this is to give access to the people, for the public to register for all the domiciliary events and for the ease of obtaining certificates. And hospitals are supposed to register the online all the births and deaths. Thank you so much for this session, and please drop me a comment or a request if you're interested in case-based filling of form, whatever specialty you are in. Mention your specialty and I'll send you the relevant module. Thank you so much.